Well, we're going to return now to our big focus, and the focus is this. Singapore as a country has in fact shut down schools because of the concern that this new variant of COVID, B.1.617, that was first discovered here in India is actually being much more transmissible in children. They're worried about that. They're seeing more infections among kids. So they've shut down schools, and a lot of people in our country have also been saying that if there is a third wave of COVID in India, children are going to be worst hit. So as usual, we're going to be asking some very specific questions with our panel of experts. Let's see what they say. Joining us, Dr. V. Ravi, the head of neurovirology at NIMHANS. Dr. Shravan Verma is the CEO of SpeedDoc in Singapore. Dr. Shashank Joshi, COVID-19 Task Force member in Maharashtra. Dr. Joseph Brito with us. He's a former consultant in pediatric intensive care at and infectious diseases. And Dr. Chandrakant Laharia, he's an epidemiologist and specialist. I'd like to thank you all very much for joining us. Dr. Ravi, let me come to you first, and let me bring up our first question. People asking questions, some of them are ours. Will children be hit hardest if there is a third wave in India? Dr. Ravi.
Vishnu, I've gone on record saying that they are more susceptible and they are likely to get infected in the third wave because right now we do not have vaccines for children, and the virus seeks out susceptible people. Already adults are receiving vaccination and more number of people have got infected. So children are likely to get more infections. Having said that, I don't want to sound alarmist. Good news is that children usually have much milder course of infection than adults. However, considering the number of children that we have in our country, we should make preparations for it. That's my point of view.
All right, and we'll talk a little bit more about those preparations. Before I come to my second question, I just want to go across to Dr. Joshi. In terms of cases among children, what are you seeing this time around in Maharashtra, where, of course, there are many strains? You know, there's been the strain of the United Kingdom as well, and there's been the strain of the B.1.716 variant. So in terms of children in Maharashtra and COVID this time, what have you been seeing?
So we have, Vishnu, clear-cut data points to compare from first wave to second wave. Below 10 years in the first wave, the percentage of people involved in this population was around 0.4%. This time it is 3%. Between 10 to 20 years, in the first wave, we had seen around 3% involvement. This time we have seen close to 11%. So if you see 14% involvement for people below 20 years of age, which means that the proportion, see, otherwise what people thought, because this is an explosive tsunami-like episode, there has been an increase, which is just a numerical increase. But I don't think it is a numerical increase. Even in this way, we have seen an increase which is sustained. Also, the strain of variant of concern is 617.2, yes, which is in Maharashtra. We don't see the other strain. That is the double mutant strain, as has been alluded to. And very clearly, the current data suggests that in the second wave, we are seeing a larger pediatric cohort. So there is data to back it up on sound basis, which has been published from the government. Now, the third wave, we already have a pediatric task force in place, and they have already laid down guidelines 3 weeks back, because we clearly see that we need to be careful because the number of PICUs and NICUs are very small. We don't want to raise any panic, but we want to sensitize the pediatricians. We have 6,000 pediatricians in the state of Maharashtra, so that we don't want to be caught off guard.
Okay.
Because there is a small entity called multi-system involvement, which can impact children, which we have also seen in this wave. And there have been admissions to places like SRCC, as well as BJ Medical College or Wadia Children's Hospital. So this time they have seen proper admissions and critical cases in the pediatric space as well.
All right, that's a matter of huge concern. Dr. Brito, let me come to you next. You know, Singapore has shut down schools which had reopened, and Singapore was handling this in a very, they were handling it very well, of course, a much smaller country. But they've shut down schools because of the strain. We aren't opening schools, but the question remains, should India delay reopening schools until such time as we get a complete grip over B.1.617?
Vishnu, thank you. I think I'd like to, before I answer your question specifically, I think we need to get some perspective. All of us, adults and children, are going to be infected. If not with this strain, the next variant of concern. So it's not a question of if, it's a question of when. We have to learn to live with SARS-CoV-2, just like we've learned to live with other coronaviruses, influenza viruses, adenoviruses that cause respiratory tract infections. There is no need for panic. We need to continue to make rational decisions, especially where our children are concerned. I don't think children will be disproportionately infected or impacted. There is very little epidemiological data available in India. But if you look at the US, less than 2% of all pediatric COVID cases require hospitalization. And the mortality rate, sadly, but is less than 0.03 of pediatric COVID cases.
Okay.
So with this perspective, the cases that we are going to see in the third wave will be proportionate to the cases that we see in the community. We cannot prepare adequately, Vishnu. We cannot have enough, as Shashank said, we cannot have enough oxygen beds, we cannot have enough ICU beds with non-invasive, invasive ventilators. We will never have the staff required for the number of beds that we need. And therefore, the only way to prevent pediatric cases right now, if you understand the transmission is very rarely from child to adult. In the family, it's from adult to child.
Okay.
Therefore, as soon as possible, we need to vaccinate the adults in the family. And that's the best way to protect our children today. To your specific question of when we should open up our schools, it's a very important issue. But till now, there is no phase 3 peer-reviewed published data as to the efficacy of vaccines. We want two things from our vaccines for our children. We want to decrease the severity of infection, so therefore decrease the hospitalization rate. And point number 2, there's very little data even in adults today. We want to decrease the transmission rate.
Okay,
so
I'm interrupting you here because I'm going to talk about vaccines for kids separately. That's that's so important. We'll talk about that in a few minutes. Dr. Shravan Verma, what are you seeing right now in Singapore where you are? What are some of the basic reasons why schools have been shut?
Sorry, Vishnu, you broke up for the last part of the question. Can you just repeat that?
Could you tell us why schools have been shut in Singapore? What is the main concern right here?
So in Singapore, what they noticed was this B.1.617 variant about a couple of weeks ago. And what they noticed was as soon as, some cases were detected, the clusters that formed around those cases was very fast and faster than it was in the last year. So due to that high infectivity and high virulence, the spread was a lot faster in all those locations where they were detected. And one of them happened to be in a school. So this was one of the reasons to prevent further infectivity of these more virulent strain that they decided to stop schools and move to home-based learning until the situation comes more in control.
Okay. Dr. Joshi, let me just bring up my next question for you. And, Dr. Brito did allude to it. I wanted a few more details. And the question is this: does India have enough pediatric COVID care wards? I know Maharashtra is preparing, but can you prepare enough for this?
So I think, a large proportion of Indian population is pediatric. And currently, based on information, the pediatric intensive care wards, Dr. Brito is right that this is a very rare thing. But if you take the total population at large, which we are talking at around close to 40 crore plus children, then, the number of pediatric ICU beds in India will be around 2,000 or 3,000, whatever little I know from public domain, which is, according to me, going to be a little short. Because even if 1% of people need admission in the hospitals, then it will still be short. So we definitely need to be prepared. I would wish and pray that every bed goes vacant, but it is better to be clear that if it is a faster spreading cluster, then we need to ensure that we are fully prepared for the same. And which is why the most important things are 3. Number 1 is sensitize the pediatric community on care for pediatric COVID. And number 2 is to ensure that we build up capacity and ramp up capacity to whatever best we can so that we can give home-based care. Most children will need home-based care or a connected care model, which is what is there. But at the same time, we should not be caught napping for the children who are worst affected and who need it the most. So I think there we may have a shortage, I don't have direct data to say the same, but we are definitely in Maharashtra as far as it is concerned. The pediatric task force headed by Dr. Prabhu is ensuring that, and the Indian Academy of Pediatrics collaborating with them, they are ensuring that the Maharashtra prepares for ensuring that adequate capacities are built and sensitization to the doctors as well as community is done.
Dr. Bittul, just to come back to what you were talking a little while earlier on, and that's our next question. How long will trials take to clear vaccines for children? Let's first talk about what we have in India. Covishield, that's still very much in the works. AstraZeneca is doing the data on that. And of course, Bharat Biotech now says that they're starting the process. So the question is, how long will the process last? Because, you know, with children, you need to be perhaps even more careful.
I don't know is the short answer, and I hope we get the data that we're looking for that will make us confident and comfortable. Essentially, we need to know what's the vaccine dose. Phase 3 will tell us what the vaccine dose is. We also want to know what the safety is. And then we want to know efficacy. Currently, there's a lot of opacity when it comes to what are the effectiveness metrics that are used by different vaccine manufacturers. Soon in India, we hope we will have a spectrum of vaccines to choose from. But when particularly it comes to children, we want to know whether it will decrease the severity of infection, meaning, see, the vaccine is not like a compound wall around your house that the virus comes to the proximity and says, I'm not getting in. Because you're already primed with antibodies, there is a battle that's going to rage. And what you want to do is decrease transmission. We have very little data, even in adults today, that transmission is decreased by vaccination. But crucially for children, we want to prevent severity and the need for hospitalization. I don't know how soon it will come. The United States, as we all know, has started vaccinating children above the age of 14 for the messenger RNA vaccine, which is Pfizer. We can't extrapolate from one vaccine platform to another, and therefore, we should, I hope, to answer specifically, I'm going out on a limb here, but I hope in about 2 or 3 months, we are confident with the data that's presented to us transparently.
All right. Absolutely. Transparent data is so very important, and the more data, the better it is. Dr. Laharia, my question to you is this. Will there be a third wave of COVID at all?
So, Vishnu, before I go to the third wave, let me come to some of the data on children.
Sure.
So we are hearing that there are very few cases and there is increase in the second wave on children. But what we need to recall that through the various sero surveys, we know that the rate of infection in the population younger than 18 years was very similar to what we found in older age groups. So the rate of infection has always been similar and children have been affected in both the waves. That's one. Second point is that we know that why children do not develop severe disease. Because the virus latches to the angiotensin converting enzyme to ACE2, and the children do not have that enzyme well developed. So that's why they do not develop a severe disease. So we know across the world there is a very limited severe disease in the children. And if this is the scenario in the world, there is no reason to believe that it will be very different in India. Now coming to the other part. Dr. Joshi shared that information that it had changed from the 0.7% to 3%, which might be correct, but we also need to put this in a context, and the context could be that whether the number of tests being done in the children had changed over the period of time. So numerator, denominator dissociation might be there, and we need to examine it more carefully. So there are many points, and I don't think that children will be disproportionately affected. However, it is also true that we need to prepare for that. But I have also noticed that there is a lot of panic going on around, and we might utilize some of the limited resources in the wrong direction, and we should be careful of that. Yeah. Now coming to the final part, and which is your core question, that whether there will be third wave.
Yes.
Of course, there will be third wave in India. We know that as we will start, as this wave will be over, there would be 40 to 60% of the total population in the country which would have developed some form of infection. We know that in January, there were 1 crore infection. At that time, the nationwide sero survey reported that 22% of Indian population had antibody, which means for every single reported case, there were 20 to 30 unreported cases in the country. Now, since January and now, there are additional 1.5 crore cases, and we are still in the middle of the pandemic. So there could be another 1 crore cases, which essentially means 40 to 60% of Indian population would have some form of antibody. We know these antibody after natural infection lasts for 6 to 9 months. So this population will be protected till the end of year, and then we are ramping up vaccination. But there would still be some proportion of population which will be susceptible. And now these susceptible population would be in the some pockets. It could be a district in some state and there can be third wave. Final part, what we can expect that there would definitely be susceptible pockets and there would be rise in the cases once again as antibodies start declining. But I foresee as an epidemiological point of view that proportion of susceptible will be less. So it will be smaller wave.
Okay.
When it
all right, Doctor, you made lots of points. We need to digest this. I want to just go across to Dr. Ravi to respond to a few of those points. What Dr. Laharia says is that we shouldn't necessarily assume that there is going to be a third wave. Even if there is, it might be quite small. And B, we certainly shouldn't assume that children would necessarily be more affected. How would you respond to that, Dr. Ravi?
Vishnu, I would like to say the following things. Look around, every country in Europe and America has had a third wave. Their vaccination coverage has been much better than us. So I would say prepare for it. Whether a third wave will be big or small will depend on two factors. How fast we can get people vaccinated. Number two, the COVID appropriate behavior people will follow. Number three, having learned lessons from the second wave, are we going to regulate crowding, rallies, elections, super spreading events? These are the most important determinants in reducing.
And
about children, let me make the last point. I still believe we should prepare. I don't think we should say that nowhere in the world children have had problems. That is a foolish strategy. We have to prepare. There's no harm in preparing. I think we have time. We should do it. Over.
Dr. Brito, I'm just trying to understand, is there a particular reason children are potentially more vulnerable in the months ahead? Is it just associated entirely with the fact that they aren't vaccinated? Or is it something to do with emerging strains which try to defeat antibodies which emerge through vaccination that potentially makes kids more vulnerable?
I think Dr. Laharia touched upon the fact that as long as in our country we have areas that remain unvaccinated or under-vaccinated, the virus is going to replicate. The natural order of this virus is as it replicates, as it spreads, it replicates and it mutates. What we don't know is, I think if you look at the data from various sources, India had its lowest number of cases, about 8,200 cases on the 1st of Feb. And much before the election campaign started, much before Kumbh Mela, the cases started rising. A lot of experts now believe that it was because of the presence of the mutant strain, where spreader events accelerated the spread. It's a very difficult question to answer. Our job is not to try and predict the future. I think what we might should do is try and prevent the future. And we don't know what the next mutant strain or the variant of concern is going to be. We need to treat this as a sort of 9/11 event, a crucible event, and try and put into place the genomic sequence that we need. So once cases, let's assume we start seeing a nadir, let's assume cases start rising again. But when they do, we need to know with genomic sequence, what's the variant of concern, and what's the epidemiological data behind the cases that get admitted. So this is an inflection point for all of us. I think it's a little pointless to predict the future, but if we put into place genomic sequencing, if we rapidly scale up our vaccination of the adults in the family, I think 5 months, the government's target of making sure that we have 2.16 billion doses from the 1st of August till the end of December. While it's optimistic, I think overly optimistic, the big challenge will be once the vaccine starts become available, how do we administer it?
Yeah.
A vaccine sitting on the shelf is one vaccine which is not in the arm of a child or an adult.
All
and
right.
that's what we need to focus on.
A quick last word to Dr. Verma, who's been listening very patiently. Could you give us an idea of what you're seeing in Singapore in terms of the existing vaccines and its efficacy against the new strains?
So in Singapore, actually, they have done a very good job of being able to vaccinate 71% of people age 60 and above, and 66% of people within 45 to 59. They've just opened the band for 40 to 44. So I would say, I mean, of course, population is much smaller than India, but the penetration that they've seen is pretty high. In fact, it was just yesterday that they approved, HSA, the Health Sciences Authority of Singapore, approved using the Pfizer BioNTech COVID vaccine for aged 12 to 15 years old. They haven't really deployed it, which they do plan to do in time to come, but they are targeting children in that age group to be vaccinated as well. Currently, they are seeing patients who were vaccinated with the Pfizer vaccine in Singapore also getting infected, but most of them, the severity of the infection, it's still, I would say, a bit too early to tell.
Okay.
But so far, the patients who've got it, it's still moderate symptoms or mild to moderate symptoms that they get.
I'd like to thank you all very much for joining us. I think we certainly can't predict the future, but we need to prepare for for any eventuality. And if children are a cause of concern, then I'm sure we all agree that we need to be prepared for that as well. I'd like to thank you all very much for joining us and having this conversation and divergent views over here. Again, that's just because we only know so much. What's going to happen going forward, it still remains unclear.